My family, I call it in my book Plan B, the Diabetes Hall of Fame, because literally everyone on my mother's side has diabetes. My aunts, my uncles, grandfather passed away from it. My mother passed away from it, diabetic complications at 41. Both my sisters have diabetes. And it goes from, in my family, from pre-diabetes diagnosis to full-on dialysis, oxygen, stroke, amputation. So we got the entire range of diabetes in my family.
It's very important that we know our family and we know our family history to the extent that we can. Sometimes your first introduction to, say, diabetes or blood pressure is knowing that your mom did and knowing how she dealt with it, good or bad, knowing the complications that she had. So sometimes that's a source of reinforcement of good behaviors. Sometimes it's a reinforcement of bad behaviors.
Diabetes is not about, oh, I gotta fit into a bikini in 3-4 months. It's really, you gotta change your lifestyle, because it's a complete circle of health. It's changing your eating habits and exercising it. It's a journey. And I always tell people it's not a race. It's one day at a time.
There are 7 healthy behaviors that we try to encourage people to be mindful of. First is staying active and being active and making that be a part of your daily routine to be more active. The importance of eating. So not just what to eat, but how much to eat, the fact that you want to eat multiple times a day. So healthy eating is one of the 7. Problem solving. A lot of times we know what to do, but in a busy day, we're running to work or we have to feed the kids or whatever, these things that we know to do get sort of pushed to the side. We know through years and years of treating diabetes and some of these other chronic diseases that there are risks. There is a risk of blindness. There is a risk of amputation. There is a risk of kidney disease. So knowing that, we need to monitor that. So patients need to see their doctor or their nurse practitioner or whomever their provider is. They need to see them and specifically have those things monitored. It's really easy to just write a prescription and hand it to the patient, but helping them take the medicine and understand why and remember to do it, that's the bigger challenge. Unfortunately, there is a large degree of depression that coincides with diabetes, and recognizing that, again, helping people recognize that they're not alone in that and working with them on some coping skills.
Unless it gets treated, then they're not going to know how to cope with it.
Teaching people how to monitor and the importance of monitoring so that they can stay within a healthy range and not only rely on their visits to the doctor to know what their blood sugar or blood pressure is. That's a very important part of taking care of diabetes.